Volunteers in Medicine exist to keep people healthy, to keep them employed, and keep them out of the emergency rooms. We are a free medical clinic who provides care to working individuals and their families who do not have health insurance. We are a volunteer medical clinic. We have a very small paid staff, and we have 230 volunteers that come and provide services here. Many of the physicians and nurse practitioners actually work someplace else and take at least one afternoon or one morning a month where they otherwise could be earning money and come here and donate their time, along with other community members that provide the front office help and medical records. Our patients are people that, I call it the people that serve you. It really runs the gamut, but a lot of it is people in the service industry that are serving us in one way or the other. Our clinic is a wonderful example of integrated care, all under one roof. So we have primary care here, we do women's care, but we also have at least one of almost every type of specialist that come here to provide care. And the neat thing about it is these providers actually kind of talk to each other. So whether it be the mental health counselors or the cardiologist or the podiatrist, they all get integrated care all under one roof, and the patients just all have to come here. They don't have to go someplace else.
There's a big gap in medical care. So many people that come into the hospital system where I work most of my days haven't had anything good done to their health care until they get into a crisis, and then they get admitted to the hospital. I just kind of believe passionately that if somebody's there to help people with basic garden variety medical problems of the kind that I encounter all the time, if we can manage those in a clinic setting, we can keep people out of the hospital and thereby really lengthen their lives and make an impact on health care in Jacksonville.
I honestly got to say that, this place has really had a real great positive influence on me, because I didn't even think a program like this exists. But with the people and how nice they treat me every time I come in here and the help that they give me, God bless them all, they're just great people.
We're lucky to be one of the clinics associated with University of North Florida, and so we have nurse practitioner students rotate through here, we have nursing students rotate through here, nutritional students rotate through here from the University of North Florida.
It's an absolutely amazing environment for students to learn. They get to see very chronically ill patients, so they certainly learn how to prioritize and work with different types of patients and different types of diseases. And they also get to see it in their own community and awareness about health care and insurance and how not having insurance can affect the entire community. It's just a well-rounded clinical experience, not just to learn their clinical skills, but community-wise to see how healthcare affects the community in general.
As a nurse practitioner student, we come in normally once a week, and we get to be with the patients and interact with them one-on-one. We get to work with the nurse practitioners and doctors here in the clinic, and then it kind of broadens your horizons as a student and lets you understand more about a different type of population that really is unique and very valuable to practice here in Jacksonville.
It really is a win for the entire community, because we're trying to keep them healthy, we're trying to keep them employed, and keep them out of the emergency rooms. A facility like this, where we have 230 volunteers that see the great benefit that it provides, really provides a win-win for both the patients and for the community at large.